It's been a privilege for the Camden Coalition of Healthcare Providers to work with the Rutgers State Center for Health Policy, PICO, the PICO National Network, and the 4 CMMI sites. We have learned so much together. We've broken new ground. The country is talking about healthcare hotspotting and superutilizers in a very different way as a result of the work that all of you have done. The Multicultural IPAs program in San Diego, California has been so exciting to watch roll out. You've partnered in very unique and interesting ways with the faith-based community, and it's important for us to figure out how to embed this into an IPA structure. So we appreciate the collaboration. We look forward to working with you in the years ahead, and we're so excited that you've begun to get contracts.
Hello, I'm Assemblymember Shirley Weber, and I'm here in support of the Multicultural Health Foundation, which is based in my district, the 79th. The Foundation's mission is to bring health justice and wellness to the multicultural communities of San Diego County. The Foundation has an innovative program called the Patient Health Improvement Initiative, based on the hotspotting model developed in New Jersey. This program has dramatically improved the health of patients while significantly reducing healthcare costs. I want to congratulate the 160 patients and their families who have completed this program in San Diego. And I want to urge my elected colleagues and other leaders to support the Multicultural Health Foundation, whose sustainable business model transforms the lives of chronically ill patients while advancing health justice.
Our vision is to create an equitable health system in San Diego County that is focused on wellness of community residents, leading to improved longevity and quality of life. We recognize that besides one's genetic makeup, their place of residence, race or ethnicity, and income are more determinative of their health status. So we focus on improving their environments where they live, educating about ethnic health factors, and assist in overcoming other low-income issues. The Foundation will accomplish this using 3 main strategies. Number 1, we will expand our proven sustainable business model that saves money by engaging the sickest and highest utilizers and then reinvesting these savings in preventive initiatives. 2, we will engage providers and community residents, making them aware of the major barriers that perpetuate illness. And 3, develop a community-based participatory research unit that we call HEAT, Health Equity Action Think Tank. This entity will identify best practices and best solutions with community input.
A superutilizer is a patient who frequently goes to the emergency department and is admitted to the hospital. The superutilizers have complex medical conditions, have significant behavioral health issues, and challenging social issues. Superutilizers represent 1% of the population, yet consume about 25% of the total health care dollars. This equates to about $80,000 per patient per year. During the past 3 years, we demonstrated on 160 patients a reduction in emergency department visits by 22%, a 31% decrease in hospital admits, and a 90% customer satisfaction level. This equates to a $30,000 per patient per year savings, which is about a 5-to-1 return on investment. We're able to help patients improve their overall health care, but we're also able to save the healthcare system a significant amount of money. We have demonstrated an incredible opportunity here.
It's crucial for us to understand the health problems and living situations of our patients so that we can truly help them. Our goal is to stabilize them as quickly as possible and get them on a long-term plan that keeps them out of the hospital. I lead the care team that visits patients in their homes for an initial 2 to 3 hour evaluation. That's what makes us innovative. Our team consists of a nurse, social worker, and a community health worker. Our patients have multiple chronic diseases. Most are confused and don't know what to do. We tell them to call us 24 hours a day, 7 days a week if they have medical crisis instead of going to the ER, and they do that. Most times we're able to help them to resolve their problems without going to the hospital, and that is very gratifying.
We work with their health plan to make sure that they get what's needed. Many of our patients end up in the hospital because they don't have the transportation to get to their doctor's appointments. We work to get the transportation they need to get to all their appointments. Some of our patients do not have stable housing, like they live in hotels or even on the streets. We help get adequate housing, which includes low-income housing or Section 8. Our patients have said that this program has transformed their lives forever.
I have been ill off and on since 2006. I had a lot of health problems. I had cellulitis in my leg, and I had to have several surgeries on those legs. And so with that, being in the hospital several times made me stop working in 2009. So along with that, my wife was having problems. She had breast cancer. And so we had to stop working, both of us, because of her lymphedema and my problems with my legs, and then my breathing got shorter. And so 2013, I actually had to have a pacemaker put in. And this is when I had met Dr. Hood through my primary care, Dr. David Graham. So he said he had a program that I probably could help me because I had gotten stagnant in a rut. I wasn't going out anywhere. Stopped going to church. I've been going to church my whole life. I stopped going to church. I stopped singing. I stopped going to any place that was a crowd because I didn't want to go because I wasn't feeling good or because of the weight. It was a time I didn't even go in my backyard for about 5 or 6 years. And then I met Dr. Hood and Alicia. They came to the house, and they were just like night and day for me because they were just so spiritual. Alicia, Montreal, and Gloria, they prayed for me right away. We sang together, and we're just like, man, this is what I need, because I was having a lot of mental problems along with the physical problems. And when I met them, it was like, wow, these are angels that have been sent. And I started wanting to get back into church. I wanted to start singing. And like I said, we sang together there. Alicia made sure I had everything that I needed from. She got me a couple of new walkers, and she got me some handy tools that I could use to pick up items to put my shoes on myself. I became more independent, just having to be there for my kids and especially my granddaughter. That's my baby girl, so I have to be there for her. It's just been a godsend. And what else can I say? I'm here, I'm happy, I'm singing, and I'm at church.
Our patients have many needs that affect their long-term health. They need to contact their doctors, pharmacy, insurance companies, and county and other government agencies all the time. But they don't know who to contact or what to ask for. Sometimes they don't speak English well enough. Sometimes they're so sick they don't have the stamina to be on the phone hour after hour. That's where our program takes over. We become their advocates, and we don't give up. We track down the right individual or agency, and we get them the help they need. What's more, we coordinate our patients' care. We bridge the communication between the physicians and health plans so they truly know what's going on with the patient.
I start feeling losing my balance, and I fell 2 times in the kitchen, 2 times from the bed, and then I was standing up and I fell again. So I couldn't walk no more. I wasn't walking no more. So Alicia started coming in, and I start calling, making appointments to go to see the doctor. And now I can have transportation to go to see the doctors because I have so many appointments.
One of the most innovative aspects of our program is that we empower patients to advocate for themselves. We teach them how to manage their own care and how to protect their health. We do this by taking the time to get to know our patients as individuals, not as a medical ID number. We're a multicultural team serving multicultural patients. That means that we recognize and honor what's important to them. If faith is important to them, then we pray with them. We work with our patients to develop a care plan, not dictating to them what we think they should do. And we're by their side, step by step, supporting them as they make this plan a reality. Our results show that this way of interacting with patients is the best approach at achieving long-term stability. It's a nice feeling to walk into our patient's home and to see them thriving because of the work that we've done together.
The volunteers are an essential component of our program. We complement the work of the rest of the PHII team to provide our patients with optimal healthcare and social services. Our volunteers consist of pre-health students like myself and community members who share the passion to serve those who need help the most. As volunteers, we routinely call our patients on a weekly and monthly basis in order to gather accurate information regarding their doctor visits and immediate health and social needs. But sometimes, the patients just need another person to listen to them and offer them a voice of comfort or a gesture of kindness. The volunteers are their source of the empowerment, encouragement, and hope they need to cope with their daily challenges. Personally, this program deepened my passion for medicine. As a future doctor, I aim to help address the social determinants of health for the marginalized segment of our society and to inspire other volunteers to contribute their talent to creating a healthy and equitable community.
We realize our foundation cannot meet these ambitious goals alone. We therefore seek partnerships and collaborations with organizations and individuals that share our vision to achieve health equity for all communities in San Diego County. Thank you.